Hello, and thank you for joining me today to talk about managing behavioral health clients based on treatment trajectories. I am Dr. Cori McMahon, Vice President of Clinical Services for Tridiuum, owned by New Directions Behavioral Health. Let's start at the beginning with socializing the idea of routine assessment. Just like we as providers take the time to socialize our patients to treatment in general so that they can get a sense of what the process will entail, we also want to include the concept of routine or regular assessment. This helps us set the expectation from the beginning and provide a rationale for asking them to complete the assessment on a regular cadence. First and foremost, however, you as the provider need to be on board with the why. Why are we assessing our patients in general, and why are we interested in routine assessment? While I'll talk in a moment about measurement-based care, which necessitates routine assessment, I'll mention here to start that we know regular tracking of symptoms and symptom severity helps us intervene as efficiently and accurately as possible. Oftentimes, we'll see that assessment is done upon intake to best understand level of acuity and specific areas of concern. Then, we might not assess again for a number of weeks, or maybe not until we're looking to discharge a patient. What we'd be missing in that instance is the ability to track symptom severity throughout the course of treatment and to use that information to help guide treatment planning and interventions, to be able to respond quickly to changes as they occur, and to use all of that great information the patient is sharing with you to inform both your clinical decisions and to improve their behavioral health literacy or understanding of their behavioral health and the process of care. When it comes to measurement-based care, what exactly are we talking about here? You might be familiar with the term measurement-based care, or you might have heard of the concept under the guise of a different name. It's also called feedback-informed care or treatment, continuous outcomes monitoring, or concurrent recovery monitoring, for example. Different terms tend to be used in different settings. But what does measurement-based care actually entail? To put it simply, it is the process of conducting routine assessment and using assessment results in session to drive treatment discussions and plans. Measurement-based care is a collaborative process of engaging patients in discussion about outcome, the therapeutic alliance, and all aspects that impact their care. It's not just about symptoms. It connects symptoms and other variables to what the client wants from their care. It's not just about a measurement process, but it uses measurement to inform and help focus clinical conversations. Importantly, it privileges the patient's voice about what is working for them and what is not. This piece is special in that patients are asked to become active participants in their care as opposed to remaining passive recipients of their care. Measurement-based care offers an advantage over simple measurement as it introduces this patient feedback loop into the treatment process. It includes 4 components, starting with routine assessment, including the use of validated measures, clinician review of the results, including how scores are trending from session to session, sharing those results and eliciting feedback from the patient, and then applying those results to treatment planning in a collaborative effort between patient and provider. The formal feedback of measurement-based care is important. We can appreciate improved outcomes, identify those at risk for treatment failure or dropout, decrease the chance of deterioration, and improve the therapeutic alliance. With this foundation of measurement-based care in mind, let's take a look at various treatment trajectories and how we can use them to guide the course of care. Routine measurement of patients' behavioral health symptoms allows the clinician to monitor progress and individualize their treatment. Trajectories are patterns of change in clients' reported symptoms over a period of time. This is actual change that can be seen in patients when measurement is used concurrently with treatment. It is not predicted or expected change. Treatment trajectories are an integral part of measurement-based care and are best identified by routine assessment throughout treatment. Periodic assessment, like pre- and post-treatment assessment, or assessment that's done at 3 months and 6 months, etc., on the other hand, is ineffective at detecting ongoing changes and informing actionable steps. Let's consider these 3 hypothetical patients who all started with a BHI or Behavioral Health Index of 98, and 3 months later had a BHI of 15, which is subclinical. If we had simply done pre- and post-test assessment, it would appear that all 3 patients benefited equally from treatment. But has treatment really been equally effective and efficient for these 3 patients? When we look closely, we can see 3 distinct patterns of patient improvement. Patient A shows slow but steady progress throughout treatment, with a subclinical score by week 12. Patient B shows quick improvement in the first weeks of treatment with a subclinical score by week 4, which remains there. Was there any therapeutic benefit during those last 8 sessions? Could this patient maybe have been stepped down or discharged earlier? Finally, patient C shows a completely different picture of change, with little therapeutic benefit for 9 weeks. Then sudden, significant, and consistent improvement. What triggered that improvement? And could that have occurred earlier? These examples highlight for us just how useful routine screening can be, revealing to us very different patterns of progress in care that will help us know when to either make a shift or to consider step down or discharge. It's important to know that patients who progress usually do so earlier in treatment. Sanders et al. 2019 identified several common patterns of outcomes for patients, and recognizing which pattern your patient is following can help you maximize the effectiveness and efficiency of care. I'll show you 3 positive outcome trajectories. This first one is showing gradual improvement and is the most common one we'll see. It's most helpful to look at the overall trend. The fast improvement trajectory shows early change, which is well established in the literature and is predictive of later positive outcomes. We know that most change will occur prior to the 5th session. This last positive outcome trajectory shows slow traction, with a slow rate of change through session 3, followed by a quickened pace. This might suggest the need for greater treatment intensity prior to session 5 and might result in you feeling frustrated and in your patient feeling frustrated. In this case, it will be helpful to manage expectations and focus on education and social support. Even with the best treatment, not all patients get better. Treatment failure is a difficult subject, but research suggests that 30 to 50% of patients do not improve by the end of treatment. Also, that approximately 5 to 20% can deteriorate during treatment, and another third or so will show no change at all. Treatment failure can be hard to detect without objective data from routine assessment. Unfortunately, with clinical judgment alone, only 1 in 5 mental health providers detect deterioration. But with formal outcome monitoring, 85% of these patients can be determined by the 3rd session, and the appropriate steps can be taken. In the case of deterioration, my patient has been getting worse since treatment began. I'll want to consider whether that is due to treatment emergent reactions, effects of life events, or maybe new symptoms. As treatment begins, patients may experience strong emotions, feel strains in the therapeutic relationship, or experience life challenges. On the other hand, with a non-response trajectory, my patient has not changed since treatment began. Both trajectories are emergent by session 3. You might begin by addressing lack of progress with your patients. Is your patient answering the questions accurately to get a good picture of behavioral health? Is there a need to clarify or reestablish any treatment goals? Is it time to shift to a different treatment approach? If no improvement has been achieved by session 5, improvement is improbable. An alternate treatment strategy, as in frequency, intensity, or type of treatment, or maybe even a transfer to another provider might be warranted. We might also consider exploring reasons for deterioration or non-response. We might consider the importance of finding the best fit therapeutic relationship, or the potential for presence of treatment-resistant depression or anxiety, especially if past pharmacological attempts have already been made. Low information trajectories are so named because the data is doing little to inform the treatment process. These profiles generate more questions than they do answers. Is this level of treatment appropriate for this patient? Are they responding to the assessment accurately? Is the assessment adequately capturing the patient's condition? A subclinical trajectory shows that my patient has been maintaining a low level of severity since treatment began. I'll want to make sure the patient is responding accurately to the assessment questions. If they are, and the trajectory remains flat, the need for treatment is in question. I might offer lower intensity resources like wellness apps or coaching, for example. Maybe this patient's specific presenting problem is not reflected on the assessment. Maybe they're experiencing a specific phobia. I'll ask them to answer the questions in the context of that specific problem. Or maybe the assessment doesn't cover the symptoms the patient is experiencing. Maybe they're experiencing symptoms related to something like bipolar disorder or psychosis. These, of course, will require further assessment. In the case of a fluctuating trajectory, my patient's scores fluctuate a lot and do not correspond to any trajectory. This is a red flag pattern that may result from either lack of understanding of the assessment questions, in which case I'll want to make sure the patient understands and is not responding randomly. Could result from the patient answering questions in response to short-term immediate stressors as opposed to the longer-term problems that lead to treatment. A focus on only short-term issues may indicate challenges with emotion regulation or coping skills that may warrant therapeutic attention. I might refocus discussion on the reasons for seeking treatment and relate the assessments to tracking longer-term issues. Thank you for taking the time to focus on understanding treatment trajectories and how to use them to improve the course of care.